Welcome to this explainer. When you hear the word schizophrenia, what pops into your head? Probably exactly what Hollywood movies tell us it is, right? Well, today we're totally moving past those pop culture stereotypes and exaggerated tropes to uncover the actual, multi-layered clinical reality of schizophrenia. It's a deeply fascinating, albeit heavily misunderstood condition. If you've pictured the cinematic version, hey, you're absolutely not alone. But the clinical truth? It is far more complex and, honestly, much more nuanced. So let's dive right in and break down the medical and psychological components so we can truly grasp what individuals living with this are actually experiencing day to day.
All right, here's a quick roadmap for today's explainer. First, we'll look at the tip of the iceberg. Then we'll dive into the missing pieces, followed by cognition and emotion. After that, we'll cover body, behavior, and function, and finally, we'll wrap things up with the big picture. Diagnosis.
Okay, let's jump straight into Section 1, the tip of the iceberg. We'll be exploring what are known as positive symptoms.
So right off the bat, we actually need to totally reframe the word positive. In the clinical setting, positive definitely does not mean good. It literally means an addition. See, these are the highly visible markers that most people incorrectly assume make up the entire disorder. A positive symptom is simply an abnormal experience or behavior that has been added to a person's normal functioning. Think of it like a distortion or an active presence of something that just shouldn't be there, like a hallucination or a delusion.
And speaking of those additions, the most common ones are delusions. Now, what is a delusion? Basically, it's a fixed, false belief that a person holds onto incredibly strongly, even when you show them clear evidence to the contrary. The absolute keyword here is fixed. Guys, these aren't just passing worries or wild conspiracy theories. To the person experiencing them, these beliefs are intensely, fundamentally real. They are absolutely unshakable, no matter how much logic or hard evidence you put right in front of them.
What's actually really fascinating and kind of terrifying is the sheer variety and scale of these delusions. We're talking way beyond the basic paranoia you see on TV. Sure, you have persecutory delusions. That's the belief that someone is spying on you or trying to harm you. But then there are delusions of reference. This is where a person firmly believes that, say, the evening news anchor is secretly broadcasting specific coded messages directly to them. There are grandiose delusions, where they believe they have exceptional powers. There are religious delusions and even somatic delusions, where someone might falsely believe an internal organ has literally vanished, despite X-rays proving otherwise. There are even cases where an individual believes their private thoughts are being broadcast out loud for everyone to hear, or that thoughts are being forcibly inserted into their brain by an outside force. It's a lot to process, right?
Now, if delusions are false beliefs, hallucinations are false physical perceptions. A hallucination is a perception that happens without any actual external stimulus. So while a delusion is entirely a thought process, a hallucination is experienced through the actual physical senses. The person is seeing, hearing, feeling, smelling, or even tasting something that is just not there in the real world.
And of all the possible sensory hallucinations, auditory ones, hearing things, are by far the most characteristic of schizophrenia. I mean, just imagine trying to go about your normal day, going to work, grabbing coffee, while hearing voices conversing with each other right in the room with you, or dealing with this intrusive internal commentary that constantly critiques everything you do. Sometimes these are command hallucinations, meaning the voice is actively ordering the person to perform a specific action. You can imagine how incredibly overwhelming and nearly impossible to ignore that would be.
So, the final prominent piece at this tip of the iceberg is disorganized thinking and speech. Because a person's underlying thought process becomes so heavily disrupted, their speech basically follows suit. You might notice something called loose associations, where they jump from one idea to a completely unrelated one with barely any connection. Or they might invent completely new words. Clinicians call these neologisms, which only means something to them. Sometimes it culminates in what's known as word salad. This is where words and phrases become so severely jumbled and disorganized that they completely lack any understandable logic or connection.
All right, let's move below the surface to Section 2, the missing pieces. This is where we focus on understanding negative symptoms. So we've seen what gets added to the mind, but here is where the clinical contrast becomes really stark. Negative symptoms represent a reduction or subtraction of normal emotional, motivational, or social functions. So while positive symptoms are the addition of things like hallucinations and delusions, negative symptoms are where schizophrenia actively strips normal, everyday functions away from the individual.
If you know a bit of medical terminology, you know that words starting with A usually mean without, and we see that heavily right here. First, there's affective flattening or blunting. This is where a person speaks in a completely monotonous voice and shows little to almost zero facial expression. Then we see alogia, which is a severe reduction in how much they speak. There's avolition, which is this profound loss of motivation to start or finish any basic tasks. And then there's anhedonia. This one is particularly tragic. It's a drastically reduced ability to experience pleasure in the hobbies or entertainment they once loved. Ultimately, all of this leads to asociality and severe social withdrawal. It just deeply, deeply impacts a person's fundamental drive and their connection to the world around them.
Moving right along to Section 3, Cognition and Emotion. Let's look at the hidden struggles of this disorder.
Now, cognitive symptoms involve intense, hidden problems with how a person processes information. Someone with schizophrenia often deals with really impaired working memory and reduced processing speed. Basically, it simply takes their brain longer to understand and respond to information. But perhaps the biggest roadblock here is impaired executive functioning. Things like planning, organizing, decision-making, and problem-solving become incredibly difficult. Just imagine trying to do a complex daily task, like paying your monthly bills or following a recipe to cook dinner, when your brain flat-out refuses to map out the logical sequence of steps you need to actually get it done. And alongside those incredibly tough cognitive struggles, individuals also frequently face severe emotional or affective symptoms. We're talking deep depression, intense anxiety, and high emotional instability. They might also exhibit what's called inappropriate or incongruent affect. This means they might suddenly start laughing at something genuinely sad or cry for absolutely no apparent reason. And of course, a huge piece of this emotional distress is directly tied to the absolute terror and sheer exhaustion of living with ongoing hallucinations and delusions day in and day out. Okay, that brings us to Section 4, Body, Behavior, and Function. This is all about the physical and functional impact of the condition.
Now, while catatonia isn't exclusively found in schizophrenia, it is a really striking physical manifestation when it does happen. Catatonic symptoms can literally freeze or hijack a person's motor control. You might see stupor, which is a massively reduced response to the environment, and mutism. One of the most fascinating and frankly alarming symptoms is known as waxy flexibility. This is a state where a person's limbs can be moved and positioned by someone else, and they will just remain stuck in that exact position, fighting gravity for incredibly long periods of time. Alternatively, you might see echolalia or echopraxia. That's where the individual compulsively repeats another person's spoken words or mirrors their physical movements.
So when you take all of this, when you combine the positive additions, the negative subtractions, the cognitive roadblocks, and the physical symptoms, we hit the true gravity of this condition. The resulting functional decline is just staggering. The individual experiences a massive, noticeable drop in their school or work performance. They struggle immensely to maintain relationships. Basic everyday routines start to break down, which leads to the neglect of personal hygiene, severe sleep disturbances, and ultimately, in the most severe cases, a total loss of personal independence.
Which leads us to our final section, Section 5, the big picture, diagnosis. Let's put all these pieces together.
Before a doctor can even step in to fully help, there's often this massive hurdle called insight. In a clinical setting, insight means the awareness that you actually have an illness. And one of the greatest tragedies of schizophrenia is that individuals frequently have very, very poor insight. Because their delusions are so rigidly fixed and their hallucinations feel entirely physically real to them, they have extreme difficulty recognizing these terrifying experiences as symptoms of a disease. I mean, think about it. If you firmly believe your mind is operating completely normally and the rest of the world is just wrong, you are naturally going to resist psychiatric treatment, right?
Because of all this complexity, diagnosing schizophrenia is definitely not just about checking a quick box on a form because someone heard a voice once. No way. It is a rigorous, highly detailed, multi-step process. A psychiatrist has to meticulously assess the exact duration and pattern of the symptoms and evaluate the real-world functional impairment it's causing. Crucially, they absolutely have to rule out other medical causes, things like substance-induced psychosis or even other psychiatric disorders like severe bipolar disorder, before they can ever arrive at a definitive diagnosis of schizophrenia.
So to kind of bring this all together, schizophrenia spans positive, negative, cognitive, and functional categories. It's the whole shebang. But remember, the exact presentation varies wildly from person to person. Not every single person with schizophrenia has every single symptom we've detailed here today. It's a deeply, deeply individualized illness that requires a highly comprehensive, careful assessment.
Which leaves us with this final thought. When we finally look past that sensationalized tip of the iceberg and we truly understand the devastating negative symptoms, the hidden cognitive roadblocks, and the tragedy of lost insight, how does that change the way we view this condition? How might understanding this full, completely complex spectrum change how society actually supports those affected by it? Keep this clinical reality in mind the next time the topic comes up in conversation. Thank you so much for joining me for this explainer, and as always, keep diving deep into the facts.